Hello, my name is Dr. April Morrison. I'm a nurse practitioner, lactation consultant, and also the instructor for course number 5024, the pediatric clinical section. So welcome to the class. I'm sorry I couldn't be with you tonight for the synchronous meeting, but I hope that this brief video will help get you guys off to a great start. There's a few things I'd love to cover. I'm basically going to just go ahead and run down through the course assignments for the semester, briefly touching on each one, and then hopefully answer some of the questions that you've had. If you have additional questions aside from what I discussed in this brief video, please feel free to email me. My email and my phone number are both located on the syllabus. I prefer email. Phone call only if it's an emergent situation is my preference. Let's go ahead and get started. First of all, I want to address the clinical rotations. So far, I think that some of you have submitted your clinical schedules. If you could, just quickly get those into the Dropbox. Also, make sure that you're looking on Project Concert to ensure that you have been cleared by the College of Nursing. It's not only important for you to get the documents in for your preceptors, but to be cleared. Make sure you're including your cleared date on your clinical schedule as well to make sure that everything is appropriate for you to get started. If you do not have a cleared date on Project Concert, please do not get started in the clinical section in your clinical site until that has been done. I want to talk briefly about the SOAP notes. We're going to have 3 SOAP notes this semester, 2 episodic and 1 comprehensive SOAP note. I think that the guidelines are pretty clear on your grading rubrics. However, if there are questions, please let me know. As for the physical assessment paper, I really wanted to get this one done early in the semester to help you guys feel more comfortable when it comes to interacting with the pediatric population. If you can understand developmentally where children are, then you will know how better to communicate with your patients and their family members. This paper will be due, I think, the 2nd week of courses. So again, if you have questions, please feel free to let me know. There is a 10-question medication calculation examination. It's not really an exam per se. However, I would love for you guys to try to use tools such as just simply a calculator or maybe your Hippocrates app on your phone. I really do not want you guys to consult with your peers. Try to really dig into the text, use your calculator, and try to calculate medications according to appropriate pediatric dosaging. Again, questions, let me know. There is also some discussion boards that are going to be due over the course of this semester. There are several clinical tools that pediatricians and other healthcare providers who work in pediatrics utilize, not only to help diagnose, but to help screen for things that may be going on with your pediatric patient and even their family members. Some of these tools are associated with reimbursement by insurance companies, and it's really important for you guys to know how these clinical tools are incorporated into clinical practice. Each week there will be a tool that has been assigned. You are to sign up for a tool. That tool is associated with a designated week. Each tool with its associated week needs to pretty much remain together. Please don't try to separate the two. During the week that you select for your tool, you're going to be the discussion board leader. So please refer to your assignment guidelines, and there you will find all the appropriate things to include in your initial discussion board post. This post is associated with 15 total points for your 100 points for the entire course. So please make sure that you are asking stimulating, open-ended questions to your peers and try to create some academic discussion around your clinical tool. As for the peer participants, you are just responsible for replying with about 2 academic posts back to the original, and try to just, again, continue the academic dialect throughout the semester. There are some online learning modules. We took out the Shadow Health experience and we just replaced it with some online learning modules. These are also associated with continuing education units or CEUs. You can also use these to help maintain your nursing licensure in whichever state that you are. Some states require CEUs, some don't, but I hope that these are of value to you. If you have questions or difficulty accessing the links, please let me know, but I do feel like these are all important modules for you guys to complete, and you'll just simply upload your completed certificates to the appropriate drop boxes. Monthly clinical logs, I'll be checking at the beginning of each month. I'll be checking for that prior month's clinical logs to ensure that you guys are making good progress throughout the course. There is no exact number of students that you'll need to be seeing every semester. However, we would hope you would see a minimum of at least about 60 patients throughout the course of the semester. In your logs, I want to make sure that we're seeing a variety of diagnoses and a variety of ages, all the way from infant through adolescent as well. As for the completion of your clinical hours, just remember there's 110. I always like to say it's better to be safe than sorry, and sometimes it's good to get a little cushion, maybe get a couple of hours in addition, just in case. You never know, especially with weather, how things may get over the course of this semester. We're almost done. Also, there's to be a faculty evaluation of you guys as you're in your clinical setting. If you're greater than 150 miles from the school or your clinical faculty's home, we will not be doing an on-site visit. However, we'll probably be doing either a phone call or a Skype for business visit with you and your clinical instructors. So we'll have to try to get that set up later, but the sooner you get your clinical schedules in, the sooner your clinical faculty member can be coordinating those office visits for you guys. There is also a mid and final preceptor evaluation. These are done by your clinical preceptor. They're completed in project concert. There are some great tutorials online and also links in the NP clinical guidelines that I highly recommend you guys go ahead and take a look at to make sure that your clinical preceptor understands and knows how to smoothly operate and navigate through project concert. I think that's about all the assignments that we have. Again, welcome to Pediatrics. I'm excited to be working with you. Please email me with any questions that you may have. Have a great semester.